from a patient and a clinician perspective, what do you see as the biggest challenges in treating type 1 diabetes?
I think the fact that it is so much work every day, and there's no break. And strangely enough, we managed to make the patients feel it's their fault. And, when they used to come to the clinic with books that they made up and they put the results in because they just wanted to make us feel happy, we would criticize them. And I remember sitting in a clinic one day and I could hear a junior colleague next door shouting, I think, at the patient going, "Do you know you're going to go blind?" They know. Of course they know. But it's tough. It's very hard to do this every day. It's a bit like, everybody knows diet and exercise. They all know what they should be doing. But to do that day in, day out, every day is very hard. And there are a couple of conditions that interact with diabetes and make it especially hard. So people with mental health conditions, we have a few patients who have anorexia nervosa and type 1 diabetes. That is very difficult because they don't want to feel well. They feel they don't deserve to feel well. But any mental health condition, and of course, having the diabetes precipitates depression. And so a lot of people feel low and frustrated and low self-esteem, and that adds to their lack of confidence to deal with this condition. And we published a little while ago a paper that looked at the exam results for children with type 1 diabetes in Wales. And we showed that overall the exam results at age 16 were exactly the same with children with diabetes and without diabetes. But the children with not very good blood sugar control did much worse, and the people with very good blood sugar control did much better than the background population. And I don't think this is a glucose effect. This is because if you can cope with diabetes, you can cope with exams. If you have a supportive family, you can deal with those kind of things. But if you don't, and a lot of people don't, and they're unfortunate and they have stress in their lives and they have broken families, diabetes is one step too far. And they end up not being able to deal with it and then getting all the complications and visual impairment in their 20s and renal failure in their 30s and then cardiovascular disease in their 40s. So I think these are the things that I would most like to make it easier for people to deal with. Is there a simple therapy that they could have?